Estimating the economic burden of work injuries and disease is a challenge. Recently, researchers developed a comprehensive framework to estimate the economic burden of work injuries and disease. It's based on three inputs. The first input is direct healthcare costs. The second is indirect productivity costs. And the third is intangible health-related costs. So what did they find? Well, four findings stood out to me. First, the economic burden for a country ranges between 3% and 10% of all the goods and services produced by that country in a year, or 3% to 10% of GDP. Second, the cost per worker injury and disease ranges between $45,000 US and $85,000 US per case. Third, 8% are direct healthcare costs, 62% are indirect productivity costs, and 30% are intangible health-related costs. Finally, 68% of costs are absorbed by the worker and family, 18% of costs are absorbed by the employer, and 14% of costs are absorbed by the public sector or system. So what's the bottom line? The bottom line is the economic burden of work injuries and disease is significant. Unfortunately, the employer only absorbs 20% of this cost, leaving 80% of the cost to the employee, their families, as well as society.